A growing number of people on social media are following profiles like Skinny Society. It's part of Skinnytok. These accounts are all about losing weight. Influencers encourage people to reduce their calorie intake and reduce really their fixation on food. But this subculture has come with a bunch of criticism. Some say it encourages disordered eating. And the Skinnytok hashtag was recently, only a day ago, just banned on TikTok. You can't search it.
And to join us in this conversation, we got our medical expert, Dr. Payal Kohli, to talk all about this trend. So first and foremost, Dr. Kohli, for the people that have never heard of Skinnytok, what is it?
It's a TikTok trend. And, like a lot of things on TikTok, we are now starting to get a lot of our information from this forum. And essentially, it's a bunch of creators and influencers putting out there their weight loss journey. So it started off mostly as kind of the before-after pictures. This is how I lost weight. These are my tips and tricks to do it. Now it's getting to the point where people are starting to give nutrition advice, eating advice, diet advice. And as you said, Alex, it's turning into a bit of a problem because depending on who you listen to, some of it goes too far. It's starting to create an abnormal relationship for people with food and with how they think about their bodies.
Well, I'm just gonna, I love Skinnytok. I live in
Do you follow it?
I do. I follow in a couple of creators, and we talked, like, there are some dark spaces in the Skinnytok world, but for me, it's motivation, and it's kind of funny, one of my favorite sayings that I'll tell myself, it's like, do you want a snack or do you want to be a snack? I'm like, I want to be a snack, Dr. Kohli, so I'm going to put down these Cheetos.
Okay.
So like that kind of, it's encouraging. I need tough love,
So
I like it.
Let's start with the positives. So what has it done that's really positive? It's raised awareness of eating behaviors, which for the longest time we've been doing absent-mindedly, right?
Yes.
And we do it in a food addictive way. It's raised awareness of a condition called food noise or food addiction, where people have a little voice in their head. They need to be eating all the time because they actually get a dopamine hit from the food. This is an addictive behavior that's actually been defined by Yale on a food addiction scale. So it's a pathology, it's a disease, and it's raised awareness of that. And then, as you said, Alex, it's changed people's motivation. So it gets people off their butt and it gets them to stop having what we call toxic body positivity, which means body positivity to the point that it's hurting your health. But my concern is that it should promote good health, not promote bad health. And that's what I worry as a physician, is that sometimes it crosses over into the negatives that we discussed.
Because it is hard to paint an entire trend with a broad brush, right? For some, it can be very motivating. For others, you don't know their history or who they're following. Every creator is going to be different. So would you say this is dangerous? What advice would you give to one of your patients who might be following it?
So I would say there's certain very high-risk groups for following Skinnytok. And if you're a parent, do not let your adolescent girl follow it, because one of the concerns that's come out of it is that you create abnormal body standards. And for some of us that are prone to either eating disorder or something called body dysmorphic disorder, where we have a distorted view of our body, we're obsessed with eating and health and looking good, this can actually create an eating disorder like anorexia, or it can create mental health problems like anxiety, depression. So teenage girls are the most susceptible, but athletes also, because they're often focused on their performance as well as anyone who's had an eating disorder in the past, or actually anyone who has extra weight. They're all prone to this. Now, having said that, I think it's probably reasonable to follow with certain guardrails, which is that you want to follow nutritionists, dietitians, not just anyone with a ring light who has some advice to give, and especially not people who are not overweight and haven't actually lost weight in a healthy way, because a lot of times you see people who look very attractive, and again, it sets up that sort of abnormal expectation. So keeping it in check, but looking for sources or ways to motivate yourself. I think we've learned so much about weight loss and obesity now with the drugs, knowing that it's an addiction. It's not just you being bad, it's a combination of behavior that drives abnormal eating.
What I do love about, a certain space of this trend is they're like, you don't need Ozempic, you don't need the drugs. Like, you have the power and the ability within yourself to control what you're eating, to control those cravings. So that is very empowering for me too, to say, okay, I can do this on my own. I can get to the weight I want to be. And then I also like to follow people who have had that journey, who can say, I've lost this, I just had a baby and I lost this weight, versus someone who's just naturally 100 pounds and, this is just how I look, listen to me. But no, show me what you've done. And there can be positives from that.
Absolutely. But Alex, did you talk to your doctor or healthcare team at all about this before you started following?
Well, I'm talking to you now on 9 News at 3.
That counts.
Check. So my point is, it is absolutely a combination of behavior and medicines and, diet. Because if you just do one, it's not going to work. In fact, what we've seen is that people who sometimes take medications like Ozempic and such, and then stop them, they don't always gain all the weight back. Because sometimes the behavioral changes associated with what they started doing different, how they started eating different, actually sort of stuck. But we also know that there's some pharmacology to it. Some of it is your set point. Everybody's body's different. Some people's thermostat is set higher. So I really like the idea of following the people who have actually lost the weight. I like the idea of talking to your healthcare team about healthy ways to do it. Because ladies, there are healthy ways to diet. In fact, the American College of Cardiology has put out a publication saying if you do 2 out of 3 of the following things, restrict 2 out of 3 of them, you're going to lose weight. So what you eat, when you eat, or how much you eat. So pick any 2 out of 3. Don't do all 3 out of 3, because that's when you start getting into nutritional deficiencies and problems with hormones and all that kind of stuff. So what you eat, low-fat food, what we call volume eating kind of low-fat food that's not that calorie dense, like vegetables and fruits and grains and those types of things. When you eat, that's that intermittent fasting that we've talked about before, eating only between 10 a.m. and 6 p.m. And then how much you eat, that's that portion control. So you fill up your plate, you put back 25%.
Oh.
And for the first week, you're going to be a little hungry. But after that, your brain adjusts, the satiety hormones adjust, and it's a healthy way to get that weight off.
Now, going back to Skinnytok, because I knew nothing about it, and I'm like Alex in the sense that when I'm sitting at my desk, and let's be honest, most Americans today are 9-to-5ers. We're sitting at our desk. We don't move as much as you want us to. I know you say like once an hour, get up, go for a little walk, and I try and do that. But we do have a candy drawer here. And it's always in the back of my mind, like I'm bored, let me just go get a piece of chocolate. Well, 4 pieces of chocolate later, times 5 days a week. So do you think in those seldom cases to have just kind of like somebody to combat those little urges is a good thing for someone like me?
I think it's a great thing.
Yeah, I might start. You're gonna have to give me.
So I think if you're following the right person, this can really be motivational and behavioral changing. I just don't want you to follow blindly.
Okay.
If someone is saying something like skip your dinner and eat a bowl of gelatin because it fills up your stomach, or don't drink water because it causes bloating, or go to the gym 4 times a day, these are not healthy behaviors, and you need to sort of be able to tell the difference. But if someone is saying, do you really need that piece of chocolate, or are you just doing it because you're bored, you're emotional, you're looking for something to do, you're trying to distract your mind, those are the wrong reasons. So I think those types of tidbits of information that can help us to get insight into our behavior, phenomenal. But I think if it sounds like you're coloring too far outside the lines, that's when you talk to your doctor, your healthcare team, and say, is this really a healthy way to do this?
Fair enough. I like it. I think I got the thumbs up. So we're gonna stay in the safe zone.
Well, you're looking great. So whatever you're doing, keep it up.
Thank you, Dr. Cole.